Well, good afternoon or good morning, and I'm actually happy to be able to say good evening for some of the folks who have registered for today's webinar, sponsored jointly by the American School Health Association and the Centers for Disease Control at the Division of Adolescent and School Health. We're also running a Twitter feed with this discussion today for the next 90 minutes or so. So you can join the Twitter feed or follow along at hashtag #HealthyYouthChat. That's
and engage parents.
That's it also has that and parents. So the whole Twitter feed is hashtag #HealthyYouthChat, and the second one is hashtag engage parents. So we've got two Twitter feeds running. Okay. Well, my name is Stephen Conley, and I'm the Executive Director of the American School Health Association, which I will abbreviate and lovingly call ASHA, with your permission. And this is my actual last webinar in working in this position. I'll be working with ASHA for the next 3 weeks, and this is the last planned webinar for 2012. So it's a little bit of nostalgia here, but we're very pleased to have an exciting topic today on engaging parents to foster healthier, more successful students. And this is actually the second part of work that we've done with one of our faculty hosts, and that is Shannon Michael. Shannon worked with us on another one related to utilization of secondary data, and it's also available. It's archived on the ASHA webpage. We have an ASHA webpage if you haven't seen it. It is not pure ASHA. You have to add WEB, so it's ashaweb.org, and we hope you'll join us there. Let me tell you a little bit about the American School Health Association, actually founded in 1927 in Kent, Ohio. ASHA is a multidisciplinary professional membership of approximately 1,000 individuals across the globe. And the mission, we like to point out, is to build the capacity of members to plan, develop, coordinate, implement, evaluate, and advocate for effective school health strategies that contribute to optimal health and academic outcomes for all children and youth. And we don't forget the teachers and the other staff within the schools either. We're the proud publishers of the School Health, again lovingly called by the acronym JOSH, which you'll probably hear us speak. But it is one of the premier journals in the fields of health education and adolescent health. If you're not familiar with it, you should be. And if you've done any research of late, I'm sure that you've run across articles coming from JOSH. If you're a member of the American Association of School Health, American School Health Association, you do receive both a paper copy or you can choose to take the electronic copy of JOSH each month. Surprisingly enough, in this day and age, we are still printing 12 issues a year, and sometimes even special issues on top of that. Membership in ASHA is inexpensive. The journal alone is worth twice the admission price of $150 for a professional member. If you join, you receive JOSH. You also have access to several school health listservs, access to our blog, which is titled The Pulse. It's our newsletter. You can join one section, 2 councils. There's a lot of discounts available on our publications on the webpage. In addition, discounts for the conference and seminars handled by the association. Today, those who are members are going to have free continuing education hours available, and we hope you'll think about joining the association, volunteering, and becoming part of this community of school health across the world, but particularly aimed at the United States and Canada at this time. We also have a new service for members we've opened up this year, which offers a variety of health insurance opportunities for members, as well as disability and long-term, short-term, and a whole host of a menu of additional membership benefits. For continuing education, or CEs today, we're offering free to our members, as I noted. Non-members, we're asking for a $30 donation to receive it. And the way this works is after the webinar, you'll receive an email. It's a survey where you'll submit for 1.5 chess credits or master chess credits based on 70% or higher participation. Believe it or not, in this day and age, Big Brother's here. We have a column that reports back to us on whether you've been naughty or nice. We can tell if you're checking your email or surfing the web, so please stay with us. You got to hit 70% participation to receive credits. It's our Santa Claus column. Only the email address from which you registered for the webinar can be utilized for receiving credits. It's just another double-check method. Excuse me. If you did not make an ASHA conference recently, we were in Louisville 2 years ago. We just left a wonderful conference in San Antonio. And I would hope that you look at October 9th through 12th for the coming year for Myrtle Beach, and it's charting a new course for school health. It's always a great place for networking, state-of-the-art workshops, and items that cover a broad range of school health issues. So please join us at the Hilton Myrtle Beach next October for the next, I guess it would be the 87th annual conference. That's kind of hard to believe, isn't it? Today I do want to acknowledge, before we invite and introduce our stellar faculty, that this is a combination joint effort with the CDC Division of Adolescent and School Health and the American School Health Association. We're very pleased to work with our friends at CDC. Again, if you don't visit the DASH websites often and you're missing a lot of data in your field, you should do your best to get there. Today I'm very happy that Dr. Shannon Michael, who is with CDC DASH, and the formal title is with Health Scientists Division of Adolescent School Health, the National Center for HIV/AIDS, Viral Hepatitis, STD, and Tuberculosis Prevention at CDC. We also have a special guest, Joyce Epstein. Dr. Epstein is Director of the Center on School, Family, and Community Partnerships and National Network of Partnership Schools at Johns Hopkins University, just up 95 from us here in Bethesda. Also very happy to point out that as we began this webinar, we took a look to see what our participants are in registration, and sure enough, it's really nice to see over 700 people pre-registered. And I have to give credit to a lot of our foreign participants to make sure that we say hello to American Samoa, Spain, Puerto Rico, Great Britain, as well as Canada. And we hope you're with us and continue to look at the variety of available archived webinars that we have on ashaweb.org. We have about 20 folks from Canada. The biggest state represented was Georgia for some reason, but we're really happy to see that New York came in with about 57 pre-registrants, and that's fantastic. Another shout out for Texas, Virginia, West Virginia, Alberta, California, Illinois at 77 folks, Maryland, that's nice, Michigan, and North Carolina, not to leave out New Hampshire with 18 pre-registrants. We have a host of webinars that we've been running for a little over 2 years now, and they're archived and available. And please, at the end of this presentation by Dr. Epstein and Dr. Michael, we will talk about the wealth of content available for free to be looked at and to be learned from leaders in the field throughout school health. And today, we'll now turn to engaging parents to foster healthier, more forceful students. This webinar will discuss how parent engagement in school health positively influences the health of children and adolescents. Dr. Epstein, I've already mentioned her directorship, is going to provide an overview of high-quality programs for school, family, and community partnerships. Dr. Michael will talk about adolescent health research at CDC, describe how parent engagement in school positively impacts adolescent education and health outcomes. She will also identify evidence-based strategies and actions for engaging parents in school health. This will end with an in-depth overview of CDC's newly released resource for parent engagement in school health. Our objectives are very clear. We think that's why so many of you have joined us, and we're very pleased to have you here. With this said, I would like to turn and introduce our first speaker in more depth. Dr. Joyce Epstein is a sociology and has a doctorate in sociology. She's the director of the Center for Health, Family, and Community Partnerships and the National Network of Partnership Schools. She's the principal research scientist and research professional of sociology and education at Johns Hopkins. She has over 100 publications on the nature and effects of family and community involvement, including a practical handbook called School, Family, and Community Partnerships, Your Handbook for Action. Third edition is through Corwin Press. And it's a textbook for college courses for future teachers, school, family, and community partnerships, preparing educators and improving schools. The second edition is through Westview. In 1995, she established a national network of partnership schools that provides professional development for schools, districts, state leaders to develop research-based programs of family and community involvement. In all of her work, she's interested in the connection of research, policy, and practice. And when Shannon told me she talked her into working for us today, there were a lot of hoops and hollers here in Bethesda at the ASHA office. We're going to run a poll first before we turn to you, Dr. Epstein. And those of you, there are two polls. You need to go to your keyboards. If there's a group of you, you need to come to consensus if you're sitting in a classroom somewhere. And you need to tell us, who are you representing? This is the first part. And if you don't see yourself listed here, please hang on for part two. We'll give you about 20 seconds to give us your data. I'd like to know who we're talking to. The highest is national nonprofit organizations. Can we move to number two?
We're on number 2 now.
Okay, please, if you weren't listed in the first, could you let us know who you are? And we've got a huge number of people who fall into other. Well, so do I. But we're very pleased to have you. And it's good to see this, Dr. Epstein. I think you have a little bit of a feel for your audience, and now you have the microphone.
Okay, well, hello, everyone. Can you hear me all right?
Yes, it sounds good.
Mm-hmm. Very good. I really would like to thank Shannon Michael for inviting me to participate today, and her ASHA colleagues for their good help in getting this ready for everybody. We're very happy that the CDC recognizes the need for forums of school, family, and community partnerships in their coordinated school health program guidance and recommendations. So this fits right in with a bigger picture from CDC, and I'm really pleased to participate. The topic today that links to the whole webinar is that we want schools and districts to understand their responsibility to organize effective programs of family and community engagement in ways that link to important outcomes or goals for students, including but not only health. And we're going to talk a little bit today about the basics for organizing good partnership programs. I'm approaching this by presenting to you 6 of the advances that have been made in our studies and others' work to organize family and community involvement so that it is theory-driven, research-based, and relevant to practice. So let me go forward with this. And let's see now. Here we go. So I'm going to be talking about 6 advances and giving you a little bit of background. I hope that you will write down your questions and for the question period later on, or you can contact me later on at any time. So first, we want to recognize that in our work, and in our work with many, many schools and school districts across the country and in Canada, a little bit in Australia too, school, family, and community partnerships as a term is better than talking about parental involvement for school programs. The reason for this is that when we talk about the programs, we mean that we're going to create a welcoming place for everyone who's engaged at the school, the students, the teachers, principals, counselors, parents, nurses, and other community partners. In the old days, we said parental involvement, and it still is so easy to say that sometimes we slip and use that term. But we mean school, family, and community partnerships because the new term, or the better term, reinforces the fact that schools have a role to play, families have a role to play, and the community plays important roles in helping students do their best in school. When we said parental involvement, it really was a case of laying this all on the parents' shoulders. So even if we say the words parental involvement, because it's so easy to say, we mean partnerships and we mean well-organized partnership programs. This also is the basis for our theoretical work. Everything we do asks, how do we reach the goal of excellent schools and excellent students and good partnership programs? I call this as a popularized picture of what is our theory of overlapping spheres of influence. We ask, where do children learn and grow? They learn and grow at home, at school, and in the community. When we bring these spheres of influence together, the overlapping areas create the partnership place. And when we work together, then we have students who succeed in school. There still are too many places who say, if the family would just do its job, the school could then do its work, but that leaves the students floating sort of in the air. What our studies show and our practical programs show, that the spheres of influence must come together in a purposeful way so that students are getting the same message from home, school, and community, that school is important, their job is to be a student, their futures are at stake, that everyone is working together to help more students do better in school. The second advance that we want to make sure is part of your thinking is that school, family, and community partnerships is a multidimensional concept. It isn't just one thing, and there isn't just one way to go about this work. We've developed a framework of 6 types of involvement that are separable and distinct. They do have different activities, challenges, and lead to different results for students, for parents, for the school, and for the community. In practice, this means that parents can get involved in different ways, in different locations, for different reasons, and what that does is it helps keep educators and others from labeling parents as if they were unable or uninterested or unwilling to get involved in their children's education. I'm going to just show you the 6 types of involvement, and later you'll see our website where you can learn much more about all of these. We don't have time right now. But the 6 types of involvement are parenting, meaning helping parents understand child and adolescent development, understanding the child as the child is growing up. All of our types of involvement are multidirectional, meaning these are two-way streets of communication. And so parenting also meaning the school understand its families. Type 2 is communicating. All schools communicate with families, but often the direction of communications is school to home, whereas we know we must build also home to school connections so that parents have a voice, have a say, have a way to ask their questions, provide ideas, and so on. The challenge there often is about the language we use and how understandable information is to all parents, whether they are speaking English or other languages at home. Type 3 is volunteering. Most schools do have volunteers at the school building. We want to stretch that definition so that volunteers can help in other locations, and also that audiences who come to school to support school activities like the band, chorus, orchestra, drama production, have a way to say they are volunteering to support the school and children's learning. Type 4, learning at home, is mainly about homework, but also about any curriculum-related decisions and course choices through the high school years. Type 1 is about the child as a child, whereas Type 4 is about the child as a learning individual. Type 5 is about decision-making, and here the parent voices come into play through various committees, through the PTA or PTO, through councils, and in the work we do on an action team for partnerships that reaches out to all families to engage them in all of these different ways. Finally, collaborating with the community engages all the community partners, not just business partners, but health organizations and senior citizen groups and others who can provide service to the school, to families, and to students, even through high school, such as in internships or summer learning or summer work, summer jobs, and so forth. These 6 types of involvement tell us that partnerships is a multi-dimensional concept. Third, a program of partnerships is a component of school organization. In the old days, this work was left up to an active parent or two, but now we know that a school must take responsibility for organizing good partnerships the same way that a school takes good responsibility for organizing their reading program, math program, or testing work, or any part of school life, school organization. In our work, we've identified 8 essential elements that we actually help schools and districts develop if they work with our network, the National Network of Partnership Schools. And you'll see in that work that there are strategies to build good leadership, teamwork, action plans, to implement the work that's planned, to evaluate the progress of our partnership programs, which has been a missing link throughout history on this topic, actually, to have adequate funding, to build collegial support, and to network with others so that we learn from each other, both educators learning from other schools and from our home base at Johns Hopkins, and we learn from the work that gets done in the field. So it's actually a win-win kind of situation. The action team structure is an action arm, a committee of the school improvement team. A lot of people will tell me, Joyce, I know all about your 6 types, but they omit the fact that the key to a partnership program is this ATP, the Action Team for Partnership, consisting of 2 or 3 teachers, at least 2 or 3 parents. The principal must be on the team because he or she is critical for progress in this way. Others may join the team who are interested in outreach to all families so that their children have an engaged, knowledgeable parent or parents, grandparents, others in their family who are going to stress the importance of good school work. At the high school level, we ask 1 or 2 students to serve on the action team. The picture you see is one of our partnership award winners from South Carolina this year, and their stories, their pictures, and other award winners can be found on our website in the section called Success Stories. This has been an active team, well organized, that is going through and working toward those 8 essential elements that I just mentioned to you. When they show they can do that and do it to meet the needs of their own community, then we recognize them so that other sites can learn from our award winners. The 4th advance says that our partnership programs must be goal-linked, goal-oriented, focused on results for students. In the old days, partnership programs focused on the parents. They were interested, did the parents come to meetings? Did they come to workshops? What we've learned over the years is our work is not about the parents ultimately. It is about the student's success in school. And so we help schools and districts develop their programs so that whether we're working on achievement or health or other outcomes or subject areas, all of the reasons we ask families and communities to become involved have to do with producing and helping more students do their very best in school so that they succeed in their schoolwork, move on, graduate from high school, and really become more successful participants in their community. Fifth, programs of partnership require multi-level leadership. In the old days, this was left up school by school. Either involve parents or don't. It's really up to you. What we've really learned over the last 5 years of my research and that of my colleagues is that district leaders really help schools build partnership programs that are of a higher quality, reach more and different families, reach families who weren't involved before, and really play a big role in whether the schools do this job in a well-organized, goal-linked way. Finally, everything we just talked about is about equity. It underlies the reason that we build better partnership programs. Currently, and always since time began, some parents are and always have been engaged in their children's education. Other parents, we find, from all communities, all socioeconomic groups, all racial, ethnic, and linguistic groups, are waiting to be helped in better ways with good and understandable information so that they can be engaged in their children's education at each grade level in ways that are going to make sense and be important for their children's success in school. In the old days, we had a deficit model, meaning we thought parents were weak or uninterested. When we focus on equity, we build a strengths model. Every family has some strengths that they can apply so that their children do their best in school. Our equity model also focuses on solutions to the challenges that often limit parents' participation. And you'll see in a moment how we focus and help schools and districts share those solutions with each other. So to quickly review, to use the 6 advances that we just described, we ask at the school level that a school has an action team for partnership, step 1, that they write an action plan that's an appendix to the school improvement plan, linked to important goals that teachers are working on so that educators, families, the community are all really focused on the same goals for helping youngsters do their best in school. This is done by activating the framework of 6 types of involvement, making sure there's a budget for the activities that go into that plan, ensuring the team meets on a regular basis, and evaluating to improve the partnership program each year. The latter is one area that we really help schools and districts do this work through the National Network of Partnership Schools. Our guidance to district and organization leaders helps them help their schools, preschools, elementary, middle, and high schools, put in place these simple but important structures so that their partnership program will match their community's needs, the school's goals for their students, the appropriate grade level, emphases, so that they really have a real partnership program. Finally, you will see in your that you will be able to obtain from the CDC's web section on this webinar that if you are ready to do this work, our network at Johns Hopkins is ready to help you. Our goal is to make you experts in this area, and we learn from that process. So we provide research-based tools, ongoing technical assistance, coordinated planning, and particularly assistance with evaluation, and many networking opportunities to do better and better every year by learning from other schools, other districts, and from my staff here at Johns Hopkins. In the best possible way, I really hope you will visit us at our website, which is www.partnershipschools.org. There you'll see in the section of publications and products, and on our homepage, a variety of publications that we offer to members of our network. Some of them are part of the membership package, like our handbook up in the left-hand corner, and our books of promising partnership practices in the middle at the bottom, in which every year sites are invited to share their best practices with each other. We also have many resources, references, articles, books, and other things. Again, please come visit us at partnershipschools.org, and particularly the section of success stories to see how this is working across the country. So now I'm going to turn this back over to you, Shannon, so that you can fill in the health story that goes so well with the structures that we've just talked about.
Shannon, if I could interrupt just a minute, I'd like to keep Joyce on the line. This is Steve Conley again, Director of ASHA here in Bethesda. Joyce, we have a very good question, and I think you hit some of it with your resources there at the end. But while you were speaking, a lady named Julie wanted to know, how can we create an additional burden on the schools? Like we have mandatory health committees, et cetera, that are embedded in schools. Are there model sites that do not have funding that have also been successful in partnering together? Could you respond to that before I introduce Shannon?
Yes, certainly. Most schools these days have something like a school improvement team or a school council, and the notion is that every year the schools will be writing a plan for improving their programs to increase student success in school. Most of the schools and districts in our network, and now we work with over 800 schools and over 90 school districts, are not wealthy districts. Most 76% are Title I sites. Everyone is busy. Teachers are busy. Parents are busy. Principals are the busiest people on earth. But the notion is that with a committee, the Action Team for Partnerships, one committee that is linked to the school council or school improvement team can then reach out to all families. In the old days, either the principal thought this was his or her job, or a parent liaison was told, you work with all the parents. This never was really successful because people leave their positions. However, the notion is that that with an action team for partnerships over time, all parents can be helped to be engaged with their children's education. If you have a health committee that is working to engage parents, their work can be linked to the Action Team for Partnerships. There's plenty of work to go around. We're not duplicating effort, but the issue is to have a formal, clear, official committee for good partnerships.
Thank you very much, Joyce. And as we are continuing through the next 45 minutes to an hour, you can ask your questions by typing them in. Ashley Dowling is monitoring those here near the dashboard. And as we step to the next phase, we're going to run another poll that we're going to issue. And I'll introduce Shannon Michael as this is occurring. And Shannon, I'll let you know as well that we do have some places across the globe where we already have partnership groups. For example, we've learned in Kansas City that Deborah tells us there are school, community, and health folks from the healthcare sector all together. It's kind of difficult for them to answer the poll with a yes, no, or one category question. So with that said, I'd like to say we're very glad to have groups with us who are working and are going to plan to work together to these models. Shannon Michael, Dr. Michael, is a public health analyst, and she currently serves as an adolescent health researcher in the Research Application and Evaluation branch of CDC under the Division of Adolescent and School Health. Her work focuses on addressing child and adolescent protective factors, such as positive parenting practices, school connectedness, and academic achievement. Shannon currently facilitates a collaborative partnership with the Division of Sexually Transmitted Disease Prevention and NYU School of Social Work to develop a series of research papers addressing parental influence on key childhood and adolescent health risk behaviors and health. And Shannon, for the second time, it's wonderful to work with you and really delighted to have you with us again.
Well, thank you for having me, and welcome everybody. Thank you, Dr. Epstein, for that overview of family, school, and community partnerships. Now we're going to dive deeper into how these partnerships between school staff and parents can support the health of students. I hope you walk away today with some strategies and actions that can support and improve parent engagement in school health. Here's an overview of what I'll cover today. First, I'll begin by defining parent engagement and explaining why it's important to engage parents in school activities. Next, I'll describe the association between parent engagement and a variety of student outcomes. Then I'll identify the essential aspects of parent engagement and strategies and actions that schools and districts can implement to increase parent engagement in school health. And finally, I'll review CDC's new webpage and available resources for parent engagement in school health. So to start with a few definitions, we define parent engagement in schools as parents and school staff working together to support and improve the learning, development, and health of children and adolescents. As Dr. Epstein mentioned, parent engagement is a shared responsibility in which schools and other community organizations are committed to reaching out to engage parents in meaningful ways. And parents are also committed to actively supporting their children's learning, development, and health. There are several reasons why we want parents engaged in school health activities. But before I share that, let me define what I mean by school health. School health can be most simply defined as policies, programs, and practices implemented by, in, or in association with schools that are designed to promote students' physical, emotional, and social development. Some examples include health screenings at school, available physical activity outside of physical education, and school rules and consequences for bullying and other possible risk behaviors. So let's now look at specific reasons for involving parents in health activities. Parent engagement promotes positive health behaviors and outcomes among children and adolescents. It also promotes positive education behaviors and outcomes. Research has shown that school efforts are most successful when parents are involved. Parent engagement provides consistency in health messages in the home and school. And it also improves health services for students with healthcare needs. For example, students with asthma, diabetes, HIV, food allergies. If parents and schools work together, they can deliver clear, consistent messages to students, encourage them to value education, assist them in getting necessary preventative care, and improve their overall access to resources and support networks. We need parent and school partnerships to ensure our youth are healthy and ready to learn. So let's take a closer look at the benefits of parent engagement in schools. Research shows students who have parents engaged in their school life are more likely to have better student health, better student behavior, better school attendance, higher academic performance, higher school completion rates, enhanced social skills. We also see these benefits for health. The research shows that students who have parents engaged in their school life are less likely to experiment with alcohol, smoke cigarettes, be emotionally distressed, become pregnant, be physically inactive. These are huge benefits. You also might be wondering, what is the relationship between health behaviors and educational outcomes? Let's quickly look at some data. After controlling for sex, race, ethnicity, and grade level, data from the 2009 Youth Risk Behavior Survey show students with higher grades are less likely to engage in health risk behaviors than their classmates with lower grades. And students who do not engage in health risk behaviors receive higher grades than their classmates who do engage in health risk behaviors. Makes sense? Also notice the stair-step progression between the grades and health risk behaviors. For example, if we look at the first set of bars related to carried a weapon, those students getting mostly Bs are significantly more likely to carry a weapon than those with As, and those students with Cs are significantly more likely to carry a weapon than those with, and so on. Therefore, not only is the overall association significant, but it's significant between academic grade as well. These kind of associations do not prove causation, meaning further research is needed to determine whether low grades lead to health risk behaviors lead to low grades, or some other factors lead to both of these problems. But to summarize, we know that parent engagement directly affects academic achievement, and it directly affects health behaviors of children and adolescents. We also know that there is an important link between academic achievement and health behaviors. So school efforts to engage parents in school health activities are critical to students' academic success and their health. Dr. Epstein described what contributes to effective partnerships. With that in mind, I'd like for you to consider those characteristics and discuss the three essential aspects of parent engagement. First, schools must make a positive connection with parents so they feel welcomed in the school and trust school staff. This has to happen regardless if we want parents engaged in health, academics, or something else. Second, schools must provide a variety of activities and frequent opportunities to fully engage parents. And third, schools must work with parents to sustain parent engagement by addressing the common challenges to getting and keeping parents involved. I want to reiterate that both school staff and parents need to work together on these aspects. The burden cannot solely fall on one group. Another important point is that this is not a linear process. So you don't connect with parents, then engage parents, and finally sustain parent engagement. Although this makes sense, the goal is to have constant efforts in connecting with parents, engaging parents, and sustaining parent and school partnerships. You can't just engage parents without considering how to connect with them and how to sustain their involvement. And these efforts need to happen simultaneously. So let's take a closer look at these three aspects of parent engagement. First, we'll look at connect. To promote a positive relationship between parents and schools. Schools and school districts should have a clear vision and mission statement that includes parent engagement. Schools should also have a well-planned program for parent engagement in the schools that includes health. If the school has a plan but doesn't include health, this is an opportunity to integrate health activities into the existing plan. You don't need to create a separate plan for health. You want to reach out to people in the school, these action teams, as Joyce was talking about, that are already working on involving parents in the school, and work with them to add activities to that plan if possible. Schools should create a welcoming and trusting environment. There should also be staff development on how to engage parents in a variety of activities as well as those relating to health. And finally, schools and teams working on parent engagement should also ask parents what they want and need. This one is so important. You'll get parents involved, especially in health activities, if you're meeting a need or an interest of theirs. And so basically we want to know what they want or need. Now let's look at the second aspect of parent engagement, engage. As Dr. Epstein mentioned, there are 6 types of involvement that schools can use to engage parents. This is based on her research for many years, and we've adapted these to be health specific. So let's briefly discuss each one of these. Provide parenting support. School staff can help build parents' leadership, decision-making, and parenting skills to support the development of positive health attitudes and behaviors among students, and help build healthy home and school environments. For example, provide parents with seminars, workshops, and information on health topics that relate directly to lessons taught in health education and physical education classes, hold school-sponsored health-related activities in settings where parent attendance is already high, such as in the neighborhood, at work, at community events, or at faith-based institutions. Another way to engage parents is through communication. Tell parents about school health activities and other community-based programs that focus on health. It also might be helpful for health-related materials to be translated into different languages or identify materials already available in languages spoken by parents in the school community. Schools can also provide a variety of opportunities. For example, school staff can involve parents as school volunteers to enrich health and physical education classes, improve the delivery of health services, and help create safe and healthy school environments for the students. Schools can also encourage parents to serve as mentors, coaching assistants, monitors, even organizers of school health activities. The fourth way to engage parents is asking them to support the learning of health at home. For example, teachers can develop family-based education strategies that involve parents in discussions with their children about health topics such as eating healthy foods, being physically active, or playing. Teachers can also encourage students to teach their parents about health and safety behaviors they learn in school. For example, the importance of washing their hands and using seatbelts and helmets and so forth. Schools can also encourage parents to be part of decision-making in the school through the PTA, PTO, school health council, school action teams. For example, schools can give parents the opportunity to be involved in developing or reviewing school health and safety policies, such as policies pertaining to alcohol, drug, tobacco use prevention, injury and violence prevention, and foods and beverages allowed at school parties. Another great way to involve parents is by asking them to participate in completing CDC's School Health Index, which assesses school health policies, programs, and practices. And finally, schools can seek help from the community to support parent engagement. This includes coordinating information, resources, and services from community-based organizations, businesses, social services agencies, faith-based institutions, again, any other community group that can benefit students and families. And schools can also link members to school and community programs that promote health and safety, such as conflict resolution training and mental health services. I just touched a little bit of what's available in our CDC's Parent Engagement Strategies document. We have over 40 suggestions and ideas on how to engage parents in school health. Some of the actions will require minor changes in the ways that schools work and can be done easily and quickly. Other actions might require more time, money, administrative changes. Schools and school districts should determine which actions are most feasible and appropriate. And again, these action teams determining that based on the needs of the school and available resources. And finally, let's look at sustain, which is the third aspect of parent engagement. To sustain parent engagement, schools can appoint a dedicated team or committee that oversees parent engagement. Dr. Epstein described the importance of an action team for partnership. She provides resources on how to run, create, and maintain these teams. I encourage you to look at these resources. It's also important for schools or these action teams to identify challenges that keep parents from being connected and engaged in school health activities. In the Parent Engagement Strategies document, we identify 6 common challenges in engaging parents in school health activities. For example, parents are unable to attend school health meetings or activities because of schedule conflicts. Parents do not fully comprehend health information and communications provided at school health activities and meetings. This might be due to language barriers or unfamiliarity with terms used among those working in schools. And there also might not be a school administrative or financial support for parent engagement. The point is, every school faces a different set of challenges. And so schools must schools must know what their challenges are and work with parents to tailor those school events and activities to address these challenges. So we're just recapping, for parent engagement to be successful, schools must connect with parents, engage them, and sustain their involvement. And this should all happen within the partnership programs described by Dr. Epstein. And now we're going to explore CDC's new webpage for parent engagement in school health. I will also take this time to provide a more in-depth explanation of our resources for parent engagement in school health. So let me hopefully get us to the page. So if you haven't visited, I encourage you to come to our Healthy Youth site. We have lots of different resources on health behaviors, but today we'll be looking at engaging parents. So as you can see, we have a spotlight right now where you could actually get our resources if you click right here. but that won't be there all the time. So I want to show you where you can find these resources. So if you go to Adolescent Health on the left side of the navigation bar on the left side and select Protective Factors, and then you can select Parent Engagement. It'll take you to our site. You can see on the left-hand side here, this is where the Parent Engagement webinar will be located. You can actually, it'll link you back to OSHA's website where they archive the webinars. We also have here an introduction of parent engagement in school health. And the first resource we come to is the strategies document I mentioned several times throughout the presentation. It talks in depth about how to connect with parents, how to engage parents, how to sustain parent engagement, and gives different ideas and action steps to take. If we move down, we have on the next, we have brochures and fact sheets available. The overview brochure is an overview brochure of the strategies document. It again talks about connect, engage, sustain. It also provides the list of resources that we do have available related to parent engagement and school health. The fact sheets below are all audience specific. We have one for school districts and school administrators, one for teachers and other school staff, and one for parents and families. So if I just click on this, you can see that this is available, and it gives you, it tells you why it's important, and then it really does give very clear action steps. The next, and then you can see, and that's the same thing for each of the other audience-based fact sheets. The next thing that we come to is the staff development program for engaging parents in school health. The facilitator's guide can be offered at faculty meetings and after-school programs for different groups at separate workshops. It's a, I'm just going to open this up and show you what's available inside. It's a cookbook approach to parent engagement in school health, and if we look at the table of contents here, you can see that it gives you we provide the learning objectives, program agenda, different materials that you need, and we have all those readily available for you, how you can use this in different ways, and then it lists for you the different the program procedures. We have several activities and exercises, and again, it's parallel with connect, engage, and sustain. And then we have handouts that go along with each of those activities, and those are provided for you as well. In addition, we have a PowerPoint slideshow that follows along with the facilitator's guide. It has the narrative notes as well as the facilitator notes. And again, a lot of the slides that you saw today are provided in this slideshow. You can use it with the facilitator's guide during a workshop, or you can use it on its own for, at a meeting that you're trying to promote parent engagement in school health. And I think that right now, that's all of our resources related to parent engagement in school health. And if I come back here, I mentioned selected parent engagement resources, and you can see that CDC strategies document, which I pointed out. We also have the student health and academic achievement site that highlights the relationship between health and academics that you can access. The U.S. Department of Education offers information on how to promote parent involvement and funds parent information and resource centers. These centers help implement successful and effective parental involvement policies, programs, and activities. And then the last one is the National Network for Partnerships in Schools at Johns Hopkins. And this is Joyce's group, and that she mentioned, and they provide schools, districts, states, and organizations with research-based approaches to organize and sustain excellent programs of family and community involvement. And I think that's about it.
Shannon, thank you. That was lovely, and I have to tell you, we've created quite a number of questions for you and Dr. Epstein. And from the general technical questions, I'll tell folks that you will receive an email related to the continuing education. You need to follow the link to go to the survey to get credits for for this webinar today. Keep your questions coming. I'm going to take them in sort of the order that it looks to me like they're most, I guess, topical and timely, and I'll ask Dr. Epstein and Dr. Michael to either take turns or one of you take over the lead. Melissa is asking, many low-income families have to work to provide for their families, and they cannot attend school-based events during regular hours. What creative examples have you seen that have worked for engaging parents outside of the normal business school hours?
Shall I take that, Shannon?
Sure, if you want.
Many of the schools in the National Network of Partnership Schools face the same problem or challenge. Today, data from the Labor Department tell us that over 70% of moms work full or part-time during the school day. They are not coming to workshops in the middle of the day at your school building. Some of our schools, if they're running a workshop, which is still a good thing to do, whether it's on health or reading or other subjects, will run the same activity once in the morning and once in the evening so that those who are available at different times of the day can attend. Others will use the new technologies of their websites, streaming video, and things that are going to go home to help parents who could not make it to a workshop have the same information that the others had who came to the workshop. On the low-tech side, we have schools that still use their answering machine to summarize a workshop parents may have missed. On the high-tech side is the streaming video, or some are now using their Facebook activities to share information that happened at school, but that those who could not come can still get that information. We want to get away from bodies in the building being the only way that schools address families or meet with them. There's hundreds, 1,200 good activities on our website in the section called Success Stories, where our books, our annual books of promising partnership practices, are presented each year to share with people the way many, many schools are addressing this very same challenge.
Very good. Let's go to another question. And I should tell our attendees and faculty, we've saved and set aside 30 minutes for question and answer. So we're going to go for another 25 minutes. And I'm very pleased that we're getting such excellent questions and really enjoy this part of the engagement. Again, jump ball for the two of you. Richard's asking, what is the typical catalyst, if there is any, that spurs a community to become seriously active in guarding ownership of the schools in the community?
Shannon, do you want to go on that one, or tell me?
Yeah, so I think it's different groups. So it can be anybody that decides, hey, this is an extremely important topic and we want the community to be involved in the school. I think it's also the school reaching out to these organizations saying that we need the help. Sometimes it's the parents are working for these different organizations and groups in the community, and they can, as an employee, go and say, hey, let's adopt a school, or let's work with this school, let's provide those resources. And so I think it's not one particular thing. I think it might be one champion that would go out and say, let's do this, but I think in terms of getting the community to be supportive and to support a school, it's several different people having to go out and ask for the community to be involved, for there to be clear things that the school needs from the community so they can articulate what that is and ask. I think the community would step up and different groups would step up. Joyce, do you want to chime in on that as well?
Many of our schools add a community partner, a strategic partner, to the action team for partnerships, so that whether it is a school librarian, a public librarian being added to the team because the school is focusing on reading goals with their children, and they know that the public librarian would be a good team member because he or she has a lot of connections in many ways out in the community to foster children's reading skills at all grade levels. Similarly, a school team might add a link to their local physicians association or hospital area or doctors group if they're really focusing on health issues. One really interesting example that sort of touches base on the attendance goal, which I consider a health outcome. Good attendance is a health outcome. One of our schools, I think it was last year, reported in the Book of Promising Practices something called family-friendly businesses. And these were certificates that the school team awarded to doctors, orthodontists, dentists, and others who had offices for their middle school youngsters, these are early adolescents, that were not during the school day. They were working on attendance, trying to keep children from leaving school in the middle of the day to go to their doctor appointments of varied sorts. And when the professionals arranged either Saturday or late afternoon or early morning activities to help these children, they became family-friendly, school-friendly businesses linked to their attendance goals. So that's another, everything, if it's goal-linked, will have a purposeful connection to the resources in the community. Because Type 6 is collaborating with the community, every program that works with the national network must reach out to engage community partners in some way. If they're not on the team, they still can contribute to activities that are planned in the one-year action plan for partnerships.
And just to also say, if I would also take a look at the collaborate with the community section in the CDC's Parent Engagement Strategies document. We give several examples of how to collaborate with the community related to school health.
Very good. And I know at one time the utilization of the Youth Risk Behavior Survey was done by the mayor of San Diego and I believe the superintendent, and every other year they would do a press conference together calling out the results and changes that they saw in children's behavior and then try to get the community engaged. Excuse me. Try to get the community engaged on those issues with that tool out of the CDC.
Mm-hmm.
Let me switch to another question, and this is near and dear to us in terms of how can you get parents and school officials to become engaged in conversations and workshops about sexual health without the stigma be associated with it while thinking of the best interest of the child or the children?
Mm-hmm. Well, I think I was recently looking at some literature and results, and some data show that I think it was 85 to 90% of parents believe that the school can provide accurate information related to sex education to kids, but the parents felt very strongly that they would bring they play a very important role, and that is in terms of their values, in terms of their culture, in terms of when and how they want to share that information. And so I think it's a great collaborative opportunity for a school to work with the parents on this topic and figuring out the best way to talk to kids about sex and health education. And I think again, based on some of the research that we've shown, that parents do believe that the school that the school can provide that scientific, appropriate, developmentally appropriate information, but again, paired with their values and their beliefs as well.
Sometimes a health education class that Shannon is talking about, when the school is doing its work on these kind of risky kinds of topics or controversial topics sometimes, we have a process called interactive homework, where if the teachers are covering particular kinds of material in class and they know the parents would like to sort of weigh in with their own views and values and opinions and want to have a reason or occasion to talk with their youngsters about topics that sometimes will slide, by having an interactive homework assignment, that is going to conduct at home in a parent survey or a kind of discussion activity. It gives the families an entree into how to approach the topic that might otherwise go undiscussed. In grade 6 science materials, which include topics on health, I think we have 15 or 20 interactive homework examples that teachers can use to try to do the kind of communicating in that way. Students are always responsible for their homework. It's not the parents' homework. But by raising questions and asking for youngsters to be in charge of these conversations, sometimes these conversations can be generated at home that otherwise would not be.
Along that same vein, Joyce and Shannon, I would say this question would go into another stigma area. Do you include resources on either of the web pages we've discussed and information on mental illness for parents on your sites?
We do not have that information on our particular website, although it's an extremely important factor in terms of parent engagement, and if the parent is going to be engaged, but we do not provide any of that information.
We do not either in terms of a parent with mental illness or anything of that nature. But those interactive homeworks that I talked about do have a couple of examples for talking about good attitudes and health and I think you would call it wellness. It's put in a little more positive frame for people to have those conversations at home, but it certainly is an important topic.
And also just to think about the role that the community plays. So I think the school, an important role of the school is to be able to provide links to services. And so if the parent has a mental health issue, the school might be aware of that. And if there's available resources, the school and the school knows about it, they can link the parent to that resource.
Absolutely.
Okay, switching to another, but these all do, of course, interrelate. Can you describe any best practices regarding how one can link the school, family, and community, those partnerships, to coordinated school health efforts that are at the state health and education departments?
Can you repeat that question again? I'm sorry.
Certainly. Looking at influence really moving up to the state level of health and education departments, are there any best practices regarding how to link coordinated school health and the three partners you've mentioned here through the state health and education departments?
The three partners.
School, family, and community.
Okay. We do have, in our network, we do have State Department of Education member partners. I think there are 12 or 14 State Departments of Education that that tell us they want to use research-based approaches to develop the policies and outreach to their districts and schools from their State Department of Education. We don't have any state health departments at the moment, but we certainly would welcome them. I think the challenge for state departments of any specialty is the outreach to their, in our opinion, is the outreach to their districts and schools. State departments are in one location, and it's very hard for them to affect the work out in the real at the school level, because they're really quite distant from those schools. But their messaging can be very important, as well as things like small grant programs and recognition programs for good work that really begin to tell the districts and the schools that family and community involvement in health, as in reading, math, and other areas, is worth working at, and that they, the state level, will recognize, support, provide professional development to help the local educators do this work. So it's a complicated role that is played at the state level. Also, some state departments have very good websites and would link to those CDC resources and perhaps our resources too, because that's part of the messaging that is going to help the district leaders and the schools do their work with their students and their families.
Mm-hmm. And also, just thinking it from a coordinated school health approach, one of the components is family and community involvement, is what it's called. And I think it's a great opportunity for there to be collaboration from the Department of Health and Education and different, when I say at that state level, it's different divisions within those state departments. So there might be an education group that's solely focused on family involvement or partnerships for academic success. But again, if we're in terms of a coordinated school health approach, we want to feed into what's already happening and existing. We don't need to create another that's parallel to it. We want to make sure that they're overlapping. That makes sense? Does that make sense?
Yes, I think so. Anything additional there, Dr. Epstein?
No, that makes sense to me too.
Well, we're going to stay with this web-based area with the next question. And Dan is asking, are you aware of any additional interactive websites that support school, family, and community partnership advocates?
Well,
Yeah.
I would start, I think that the two you heard about today they are really perhaps the most chock-full websites that I know about. And if you have questions in particular, there are many, many, many resources out there, both in organizations that work on family involvement, on community engagement, and on a variety of other things. But the resources on the CDC website concerning health and on the NNPS website on program development and 1,200 examples of work directly from the schools and all of the other research information. I would start there, and then if you have some other questions, if you put family and community engagement on Google, you will be overwhelmed because the numbers of hits would be in the millions. So you have to really tame this beast. And one way to start is to understand the systematic approach based on research that we're trying to help people get in place. Once the basics are in place, then anything that comes along from other resources can be easily integrated into a good partnership. And there are many resources that are out there. Without the basic structure, people really do get overwhelmed because there's this good activity or this good idea, and there's nowhere to really place it. And I think that getting the structures in place for an action team, and a plan, a way to evaluate progress, helps people use the many, many diverse resources that A, are out there now, and that B, will come along every day from now on.
Let's turn next. We have a question related to professional development for teachers. Are there good examples of school districts that are really seriously looking at teaching teachers how to engage parents? Can you give us some specific locations or districts or states?
Well, I know that Michigan, they actually had a document that talks about parent engagement in school health or in health, and they've done a lot of work. In terms of specific examples, I don't have those off the top of my head. Joyce, I'm sure you do, just because you've been working with a lot of these districts.
We have about 91 districts that are part of our network, and they obtain professional development from NNPS so that the district leaders can work with all their schools. Once the school has their action team, the action team becomes the staff developer, so to speak, of the other teachers in the school. If you want to see those who really are getting this sort of all together and are making notable progress worthy of note. I would go to our website, again, that's partnershipschools.org, and in the section Success Stories, click on the award winners. There you'll see the stories from I think this year there were 22 programs at the district and school levels that really showed that these sites are taking the professional development seriously. Some come to our fall conference. We provide professional development to teachers, principals, superintendents, and others each year, as well as out in the field on a contractual basis. But the purpose of the professional development is to make experts out there so that each district and school and state can really take charge of its work. And we're here to help them do that. The expertise cannot be in one place or another. It's not at CDC and it's not here at Johns Hopkins. The expertise has to be out there. In order to do that, we have to provide that training, and we do that. And CDC now has their professional development opportunities too. But to make it happen, we really prefer not doing one teacher here and one teacher there and this teacher who wants it and that next teacher who isn't interested. We really prefer the team approach that says this school will build its program of partnership so that every family that enrolls their youngster here will know that this is a partnership place. So for that, we really go with this team approach, and then everyone gets their professional development over time.
I'm going to combine a couple of questions here because I think they're very related from Barbara and Carmen. And Barbara was noting that we haven't local health departments. And the one section, the way this relates for Carmen is, what are we defining in terms of the community? Is it social services, cultural services, neighborhood associations, those who are next to the school in proximity? Because in many cases, the children don't live close to their own schools.
Right. That's a really good point. I think we mean all of it. So I think, when we talk about community, we do mean community-based organizations, businesses, cultural and civic organizations, social service agencies, faith-based organizations, health clinics, colleges and universities. But there is that problem. I've worked with a school that actually was in Baltimore that they have their kids are bused in to that place, and they live anywhere from an hour to an hour and a half away, and that poses a huge problem. I talk to them a lot about parent engagement, and it's really difficult, and to get that community buy-in. Again, I think in terms of community buy-in, it would have to be where that school, one part is where that school is located, so you can probably get some buy-in there. But again, if there's community groups wherever those kids live, we would hope that there are services there that could reach them in their local home community environment. But I think that's a huge challenge, and I don't know any good answer to that. Do you, Joyce?
Well, I think that the issue is it is a challenge. Community, as the questioner noted, can be right around the school, or as you're noting, the community kind of a picture of concentric circles. You can keep expanding from around the school to where the children come from on the buses, to where they go to school or after-school programs, to even as far out as where their parents work. There are people in all of those broadening community areas that care about the quality of the children's schools. What we find, again, and you'll see loads of good examples in those books called Promising Partnership Practices, you can actually use the search function on the website for those books and call up Type 6, Collaborating with the Community. And you'll see that places, the schools are reaching far and wide, as Shannon and as I suggested earlier, to the goal-linked community resources that will help with either very mundane things like improving attendance by rewarding youngsters through their community partners when they have improved attendance from one quarter to the next, to rather really difficult kinds of issues of families with health problems and the referrals that are necessary to get them health services. So again, to think in terms of the broadening circles of space, not just right around the school, but extended out to where the children live and broader, some have even linked to where the grandparents link via the website and various Skyping activities or school TV stations and so forth. So community is the largest concept in sociology. And we have to, again, we have to tame that beast too. And what we find is that the action teams for partnership that are linking anything they do to a particular set of goals, two academic goals, a non-academic goal like health, and overall goal for good partnerships, will reach out strategically on purpose to the resources in their community, however that is defined.
Very good, Joyce. I have to say, we are extremely timely here. We're going to take a couple of more questions for you folks in the faculty, but yesterday, National Public Radio had a piece on Virginia's educational goals. I want to editorialize. I think there were a few other states in the same category, but different standards were being set in the process to be codified on race and the culture of students, seeming to propagate continuing achievement gap. And I'll just add a little bit that Asian kids were being given an 82% passage rate in English. Caucasian kids a little bit lower, African American kids lower than that, and then the same with Latino and special education. Don't know if you're familiar with that, but I guess what we're looking at is how can parents be engaged to get involved in this type of top-down serious changes in the way kids are evaluated.
Whoa, that's a heavy one. That's a heavy question. I am not familiar with that particular report yesterday. But let me just quickly say, Type 5 decision-making in our framework asks for district level, state level, and school level participation by all families, not just the active parents, but by all parents in decisions that affect the children's school life. And so whether it's a district advisory committee at the district level, or the school's action team for partnerships, or the school's improvement team, there are important ways to build the voices of parents, including those who would not typically be the leaders, but who are still the youngsters' families, into the discussions, forums, and decision-making processes that go on for evaluating youngsters, for closing achievement gaps, which is really the main point of any of those discussions, is not to accept achievement gaps, but to close achievement gaps. And family voices have very important parts to play in those discussions. So this is a process, and the process requires the participation in systematic ways. So we can raise an issue, and then we look for good solutions, and they're usually not speedy, but they can be really well planned and quite inclusive. And it is that inclusivity that would be required in what I'm hearing you talk about.
To tell you, too, you're getting a lot of great encouragement from our attendees as well. Thanking you for these insightful answers. And with that said, I'll go to the very last one.
Quick thing,
I'm sorry?
Can I just say one quick thing?
Oh, certainly.
Just to related to that question that you just asked.
Go for it. Yes.
Well, and it's not to. I'm not going to go down that path, but I want to kind of just step back broader and just make sure that, I guess, a key message is that we really want to motivate parents to be engaged in their schools, no matter what SES level, what race, what anything. And I think the things that we really need to make sure is that parents do believe that their actions will improve their children's learning and well-being, and that that we set expectations too, that we want parents, that in a society that we need parents involved in their kids' daily lives, and that includes in school.
Right.
Very good. And I apologize to those of you we didn't get to your questions because there's so many are so good. There's questions on reaching parents in rural environments, et cetera. But let's do the last one because we had a package that came in related to school-based health centers. And Nicole specifically, and I think Michigan, I got a couple of additional rah-rahs here. But do the presenters have any information on the role of school-based health centers pertaining to student health, and how might we engage parents in this aspect of school health?
Well, the good news is I just submitted a workshop to do for their national conference for national school-based health centers. So I hope that's accepted and that I get to do a workshop on parent engagement in school health. But I think that they play a very important role, and I think that that's another opportunity in terms of health services, linkages to health services, that can be a great place for parents to plug in and to involve parents in that and to support the health of kids through that mode.
Excellent. And with that, I'm going to have to close and thank you both very much for a really engaging 90 minutes and really appreciate you hanging on for the variety and volume of questions that we had. Again, if you're seeking continuation credit through the American School Health Association, you're going to be receiving an email to the address that you registered. Follow the link, fill out the monkey survey. As long as we see that you've been participating about 70% of this event, you're eligible for credits. Would also point out that this is about the 10th or 11th that we've done webinars. They're all available on the ashaweb.org website, and they range from the impact of stigma upon seeking mental health services to the National Sex Education Standards. We have 2 events dealing with how to utilize those. More on stigma related to the families and the children looking for mental health service. Asthma, which affects about 10% of the classroom. We have an asthma control, excellent webinar, much related to the best practices for school health educators and coordinators. We have 2 sessions on bullying prevention. And with that said, I want to thank everyone on our staff, Lori Lawrence and Ashley Dowling, for helping over the past 18 to 20 months. And this has been a ball. I really enjoyed working with many of you. Last time I'll be doing this, and I hope you join ASHA. If you're not a member, it's inexpensive. That's the way to get into the whole community of school health advocates. Our special issue in March of the Journal of School Health is based on obesity prevention. There are 2 webinars with dates to be announced related to that with funding from the United Health Foundation. And with that point said, I'm sure I forgot some things, but thank you all very much for a wonderful afternoon, morning, or evening, depending upon where you are on this great globe.
Thank you.
Thank you.
Thank you. Thank you, Joyce.
Thank you, Shannon.